So receptors, these are the various different types of receptors which is present in our body. Remember the name of the receptor and what sensation it is carrying. Okay, so this will be in your MCQs. Which receptor for which sensation? Okay, first one is mucinous corpuscles, specifically for touch, and Merkel's disc also for touch. Okay, and Pacinian corpuscle for pressure. Remember P, Pacinian corpuscle for pressure. And free nerve endings. In all parts of the body you have the pain receptors. So it is freely present in all the parts. Remember, all these points is just for your easy remembrance. Free nerve endings all over the body you have, you will feel the pain sensation. Okay, and finally Croce's end bulb for cold and Ruffini's end organ for hot sensation. So these are the few sensory receptors and its specific sensations whatever it is carrying. Okay, clear? And based on the location you will term it as the cutaneous receptors, chemoreceptors and telereceptors. So whatever receptors we have seen now, they are all the cutaneous receptors which are present in our skin. And then chemoreceptors, the receptors for taste, olfactory receptors and the taste buds which is present in your tongue. They are carrying the chemical sensations. So they are called as chemoreceptors. What taste, what kind of food you are eating and its chemical sense you are sensing. And then the olfaction, the presence of chemical substance in the environment that you are sensing because of these olfactory receptors. And these receptors, all the things which is been, when it comes to the contact with the receptors, it will do its function. But there is also receptors which will not have direct contact with the receptor, but you will have the sensation. That is vision and hearing. They are called as telereceptors. There is no direct contact with the object with your eyes and the rods and cones, but you are able to see. That is why they are called as telereceptors. The vision receptors is rods and cones, and for hearing, organ of cortex. That is the specific sensory receptors. And there is another category of receptors, you call it as muscle spindle. Where is this muscle spindle present? This is the receptor of what? Muscle spindle is a receptor of the skeletal muscles. This is present in the deepermost part of the all skeletal muscles. Whether you are flexing your arm, for example, I am closing your eyes and then I am extending your arm, flexing your arm and asking you what I am doing with your arms. You are able to tell that I am flexing, I am extending. How we are able to tell that? Because of the muscle spindle. So these muscle spindle are the receptors for proprioception. Proprioception is the positional identification of the specific part of the body that you call as proprioception. So they are called as proprioreceptors. They are present in the deeper part of the belly of the muscle. We have some specific parts in the muscle spindle. See, this is the sensory muscle fiber, that is the muscle belly. In the deepermost part you have this structure, this is called as muscle spindle. In the muscle spindle you have the fibers like this. See, there is some fibers which have some central bulging over here. They are called as nuclear chain fibers. And there are also some fibers. In this case the nucleus is aggregated only in the bulged region. And there are also fibers which have a row like chain of fibers. They are called as intrafusal fibers. Okay, so this intrafusal fibers have nuclear bag fibers, nuclear chain fibers. This kind of arrangement is nuclear bag fibers. This is nuclear chain fibers. So these fibers are the one which is going to carry the movement sensation, through which it is going to give to the higher center through the motor fibers, alpha motor fibers and gamma motor fibers. Okay, so this alpha motor fiber, see in this picture, the alpha motor fibers are having its innervation to the muscles, muscle fibers, and the gamma motor fibers are having its innervation to the intrafusal fibers. These muscle fibers are called as extrafusal fibers, which has the muscle fiber, sensory muscle fiber, and this center intrafusal fiber, they are the motor fibers, which has nuclear back fibers, nuclear chain fibers, which is being further innervated by this alpha motor and gamma motor fibers. Through these fibers, the movement is going to be carried to the higher center and make us to identify the category of movement proprioception. Okay, so that is called as muscle spindle. And moving on to the other category called as reflexes. Reflexes, for the reflex action to take place, you need a receptor. From the receptor, the afferent nerve fibers will carry to the higher center, and the higher center will analyze and give it to the afferent nerve fiber and to the effector organ, whether it is a muscle, nerve or whatever it is. Together we term it as effector organs. Okay, so this is the component which you need for a simple reflex reaction to take place. So based upon this, we are classifying the reflexes. Okay, this is based upon the number of synapses. If you have a single synapse, that is monosynaptic, or multiple synapses, polysynaptic. In based on the development, yesterday we have seen conditioned and unconditioned reflex. The thinking of a food, sight of a food, or talking about the food, the thought of the food, it is conditioned reflex. The presence of food in your mouth, the stretch receptors receiving the signal and giving the signal to the higher center, resulting in the gastric secretions. So that is based on the development you are getting that. And based on the clinical classification for clinical diagnosis, you have the reflexes that you called as clinical classification of receptors. The one is superficial reflexes. The most commonly practiced superficial reflex is the plantar reflex, and knee jerk for the deep tendon reflexes. And some visceral reflexes like micturition reflex, swallowing reflex, vomiting reflex, they are also reflex actions. Okay, only up to the oral phase you can control the deglutition. Once when it crosses the oral phase, you can never control the movement of bolus within your esophagus. So if it is involuntary, then it is called as reflex. Okay, and some pathological reflexes, abnormal reflexes, example like Babinski sign. Everyone is aware about Babinski sign? Scratching the lateral part of the sole of your foot. Then what will be the response you will get if it is positive Babinski? And what is the thing if it is negative Babinski? Scratching the lateral border of the sole of the foot towards the big toe. If you scratch like this with the reverse point of your pen, do it with your roommates while they are sleeping and observe Babinski sign and also get the kick from them. Okay. So what it is, the main indication of upper motor neuron lesion. Usually the response what you will get is dorsiflexion of the big toe. The big toe have its dorsiflexion, whereas the fanning of other four toes, the other four toes will fan like this. So only the dorsiflexion of the big toe and the fanning of other four toes you will get. And this is called as positive Babinski sign. It is the pathological reflex indication of upper motor neuron lesion. Okay, so it is most commonly seen in comatose patient with patient deep anesthesia and normal in children between age of 1 to 2 years, because the neural development is still happening until they attain the age of 2. The complete development of the nervous system is over by the end of age 2 only. Okay, so below 2 years of age, if you get positive Babinski sign, don't consider as a pathological cause. It is normal for them. Okay, clear? And also normal in adults during sleep. So you can get positive Babinski sign, and don't blame me if your roommate is kicking you. Okay, clear? Just do this and see the positive Babinski sign free of cost. Okay, and superficial reflex, the most common thing. Abdominal reflex you can see, and the plantar reflex you can see. This superficial reflex, if positive Babinski sign, negative, you can also see. That is superficial reflex. And the deep reflex, most commonly you are seeing is the knee jerk. In knee jerk, what you will observe? Plantar reflex, there will be small forward movement of your leg during the knee jerk. So that is the tendons you are seeing. So these are all about the reflexes. And